Hi friends, welcome to Raquel's plant-based channel. I have to put out a disclaimer. I'm not here to sell you anything. I'm not working for a doctor. Um, I'm a registered nurse that is truly interested, and my passion is to look into remedies that can help you live a better life and make sure that your body is functioning perfectly without depending on any kind of medications. So I'm all about that. Okay, so just to follow up, somebody had asked me after my first video, Raquel, I don't have cholesterol issues, but I do have high blood pressure issues. So how can you help me with that? Okay, well, the plant-based way of eating is a perfect way to start. Of course, like I said in the first video, you start gradually. Make yourself a schedule, Monday, Wednesday, Thursday, Saturday, if you would like. You eat animal products, and then the other days you eat plant-based, and then you slowly decrease the amount of days that you eat your animal products, after about a month or two. Everybody's different, so you just use your best judgment. I'm not here to tell you what to do. I'm here to just educate you on what I found that works for me, and I've helped a few neighbors and some friends, but you really have to be ready to start a plant-based diet. If it's not your season to change, then it's not going to happen. If you're hesitant, if of course you're always going to question stuff. Everybody, you're not human if you don't question stuff or doubt. But I am living proof. You have high cholesterol, this way of eating does work. For high blood pressure, there has been clinical trials that have found the combination of meat and salt, or any kind of animal products. Cheese has salt, because that's cow's milk with salt. Anything with an animal product and salt combination will increase your blood pressure. I will put a link below. Dr. Michael Greger, who has done massive research and clinical trials that have been performed, and he has written about it and the results of those clinical trials over many years. So look out for that down below in the comment section. Another topic I want to talk about that is huge here in North America is diabetes, specifically type 2, which is curable, and there are trials also about that. And I'll also link that article by Dr. Michael Greger below, how if you decrease your animal intake, because animal products are nothing but fat. When you decrease your animal intake, meat, cheese, milks, also products with a lot of preservatives that come in a bag, that come in a box, Hamburger Helper, cheese and chips, Coke, all those very complicated things for your kidneys and your stomach to break down. You wind up getting, unfortunately, diabetes. And especially if you have a family history that's prone to that, and you're eating the same way. We eat the way that we're taught, and typically the way our parents eat and their parents eat, and so on and so forth. A lot of times it's a generational thing. So many times it's not because your mom has it that you're going to get it. It's because of the way that you eat that you get it. Now, saying that, people say, well, you're susceptible to a lot of chronic conditions because of your family history. Yes, that is true. But if you can do everything in your power to try to get off of the medications that you have been on for years, or to prevent, you're not on medications now, but you want to prevent from being on medications, start now. So do it gradually, because you do not want to fail. So diabetes, I drew a picture, so you're gonna have to excuse, I'm not an artist at all, and I hope you can see this. But if you haven't been explained exactly what diabetes is and how it works and how it is affected, I drew a picture to simplify it, lack of better terms. Here's a nucleus. I don't know if you can see that. There's your nucleus. And glucose is trying to get into the nucleus, but it can't because there's fat in the way. Okay, so the glucose needs a friend, and his name is Mr. Insulin, who has the key to get into that cell. So the fat is blocking glucose from getting in. So that's what diabetes basically is. So once you decrease the amount of fat intake, the amount of animal products that you eat, because if you think about it, the standard American diet is bacon, sausage for breakfast with eggs, fried in butter, hash browns, fried in butter. Then you wash it down with maybe a soda or Sprite or whatever have you. You know, that's it. And then for lunch you have a ham, cheese or turkey and cheese on bread, white bread with mayo made out of egg yolk and lots of salt. You know, and then for dinner you might have a pot roast, which, you know, pork is filled with fat, and then you have potatoes swimming in the fat of the pork roast, and then you have green beans with bacon, you know. So if you stop and you think about everything that you eat, no wonder why North America has high blood pressure, has diabetes, has massive cholesterol issues, is dying of heart attacks because of all the fat that you're putting in to your diet on a daily basis. But it's what we're taught. That's normal. But now we know better. We're grown and we're being educated, and we could do our own research ourselves. With that being said, there is a few links that I'm going to link below that'll help explain my message, maybe a little bit more extensive. So I'm going to leave the link to What the Health down below in the comment section, and also Game Changer, which is an excellent movie. So please like and subscribe to my channel. Post any questions that you have, and my next video I will definitely answer them. Okay, y'all take care. God bless.